Hello, my name is Joy Ashby Cornthwaite, and I will be your host for this episode of the live stream show, MyDiabetesHQ Live. This weekly broadcast is developed and produced by Cities Changing Diabetes volunteers from in Houston and our sister city, Philadelphia, which recently joined the global network of 25 cities working to improve diabetes prevention, care, and management. You can learn a lot more about Cities Changing Diabetes by going to citieschangingdiabetes.org. The purpose of this effort is to help people with diabetes and their caregivers successfully transition through these challenging times of COVID-19. Each Saturday, we gather diabetes care experts to discuss and to share their incredible knowledge about diabetes. They have years of experience in self-care, medical care, public health, community health, and advocacy, and will bring their knowledge straight to your waiting eyes and ears. We hope that these conversations will give you the tools to build skills to manage diabetes and to live your best lives. Not only surviving, but thriving and doing the things that you want to be doing. Today's episode is coming up right now. You don't want to miss this. Hello, all you diabetes warriors, champions, and advocates. Welcome to our 13th episode of My Diabetes HQ Live. We're joined by My Diabetes HQ Facebook and YouTube channels, and thank you and welcome to our show. We're happy to have you here with us. So we all know that living with diabetes means making thousands of decisions on the fly and in the moment. This can lead to a delayed planning for emergency events outside of your control. This morning, our guests are two incredible women and diabetes advocates. They are here to share with us their own personal experiences of living with diabetes and dealing with disasters. Today, we will discuss how the lessons they have learned while helping others has shaped and how they choose to safeguard their diabetes care in any situation. So, while we're doing so, tell us where you're watching from, and while you're there, join me and Maryanne Strobel, registered nurse and fellow, hi, Maryanne.
Hi.
And fellow certified diabetes care and education specialist, as we give a warm welcome to our colleagues and dear friends, Reva Verma, CEO of Reneka App Builders. Hi, Reva, good morning.
Good morning.
And Serena Valentine, CEO of Core Initiatives and Houston Diabetes Peer Support Coordinator. I know I'm like really teasing right now, but these women that we have here on the panel today are just incredible humans. So throughout this broadcast, we will all welcome questions, and we'll try to get to as many of them as we can. And even if we don't, leave your questions in the comments on Facebook or YouTube, and we'll get back to them and answer them for you. So good morning, everyone.
Morning. Morning.
So I thought that we would start off while we're waiting for everyone to grab their coffee, grab a book. I don't know why they would be grabbing a book, but perhaps grab a book.
Take notes.
Hey. They're supposed to be listening to us. While everyone's getting ready, I thought we could begin with something that's rather small, right? But it can be a disaster, because we want to set the table to have a discussion around disaster preparedness, but also smaller things that could end up being disasters for people living with diabetes. And so a couple of questions that I had this week during clinic, a lot of questions that I had this week during clinic surrounded hypo and hyperglycemia. So high blood glucose events, low blood glucose events. Do you ladies have any specific situations that stand out in your mind that you want to kind of walk us through, and then problem solving for those? Because, some of our viewers a lot of our viewers probably have the same experiences here.
Mm-hmm. Okay, well, I always remember, and this will always be etched in my head, I always remember Harvey in Houston. And after Harvey, I didn't particularly get impacted by it, but a lot of Houstonians did. So I did some volunteering at NRG, and there were a lot of cases where a lot of people who were dealing with diabetes, their blood sugars were high, like really high, and they were hyperglycemic. Oh, sorry, y'all. I know we got educators on here. So I remember that, and like I remember, Joy, you talking about at the shelters, there's always going to be carbs, always going to be carbs. And so a lot of times that's the only thing that they can choose at the shelters, unless there's other options that other people donate or bring. So the thing was, which I learned from you, Joy, is to make sure you have prepared a protein. Like I remember you saying either like canned tuna, canned chicken, or something like that to offset the carbs, because there will always be carbs anywhere you go. So I remember that. Yeah.
Mm-hmm. Yeah. And go ahead.
Well, I had a more recent experience with high blood sugar. So I had switched pumps from the Medtronic to the Tandem. Do you remember this, Joy? You were like talking me through this.
I remember.
And I guess since we were doing virtual training, it was a little bit different than in-person training for, the new catheter sets and how to fill up reservoirs and all that stuff. So we put the new site in, we put the new reservoir in, we put the new sensor on, and we thought we were good to go. And then as the hours went by, I started to feel kind of sick. And it was like, I was confused because I was like, no, this is supposed to be my automatic pancreas, and I'm supposed to be like, on autopilot. Well, then we tested my blood sugar, and it just says high. There's not even a number. And then I start to throw up, and then I call Joy, and I'm like, Joy, something's really wrong.
Yeah.
So we had to do some problem solving there, and we changed the site. And what I learned from that experience was, she's like, well, have you checked your ketones? And I was like, no, I'm just high. And she's like, no, you need to check your ketones because you're throwing up and you're dehydrated. And I didn't have ketone sticks with me, or they were expired, and this was during the COVID situation, so I had moved back in with my parents for a little while, so I didn't have all the normal supplies I would normally have accessible to me. So now I have new ketone sticks handy for if I have a kinked up site. So that was a learning experience recently that I went through after 17 years of being a diabetic.
Yeah. And like Serena was saying, when you're in a different place, right? So she experienced, people being evacuated in like a storm event in the shelter, having hyperglycemia, but they probably didn't have ketone strips with them, right? And you're experiencing the same thing at home. And what you didn't know is that I actually, when I got your message, I went into, high alert, so like my heart is racing because I'm thinking, oh no, is she okay? Is she, so the people who support you are also kind of experiencing this very differently. But I was like wanting to get in the car and like you.
Do you have water? Do you have Gatorade? Do you need me to come spend the night? I was like, yes, I'll drink lots of water, and yes, I'll drink sugar-free Gatorade.
Yeah, so I'm talking you through this and saying, check your site. Are you noticing, is it wet? Are you smelling insulin? Is it kinked? Like all these, all of the all of the clinician stuff and the supporter stuff that's going through her mind. And at the same time, Reva is like comforting me, feel better and hydrated. So it's like this back and forth, and I'm calling the pump rep, and Maryanne has gone through this as well, and so she's not telling her who I need help for. I just call her sometimes, and I'm like, what about this? It's not mild ketones. And so I think that we all work as, maybe one of the things that we get out of this is, if you're a person living with diabetes, you need help, right? Yeah. You need to find your support team, know that you can call them in the middle of the night, and they're going to be right there on high alert with you. But then also, as the supporter, know when your person, when your friend, when your colleague is saying, look, please don't drive over here. Like, I'll bring a sleeping bag in my house. Like, I'm good.
Learn to let go.
I think you bring out a really good point, Joy, because there's a couple of things here. So, yes, we suffer along with you. We, the caregivers, we do feel your pain, and we are very, very worried about you. And we like that you call us, we don't want you not to call us. We would like that you call us. And then another point that Joy brought up is, like calling the technical support, or like, calling another, diabetes care and education specialist. Because like Joy, she's an expert as a dietitian and also a certified diabetes care and education specialist. And I come from the nursing world. And then we have colleagues who are physicians, we have colleagues who are pharmacists, we have colleagues who are psychologists and exercise physiologists and social workers. So we all need each other because we all have different pieces that we can sometimes bring to help solve that puzzle. But know that we suffer along with you. We get very, very concerned about you. And the other thing I just wanted to mention about people wearing insulin pumps, so if anybody's out there wearing an insulin pump, is that if you start to see that you take a bolus through your insulin pump to try to correct a high blood sugar and it's not coming down, and you try it twice, then you probably want to get out some syringes. So we're talking about being prepared. So people with insulin pumps also need to have some insulin syringes or an insulin pen that they keep on the side, because if your site's not functioning well for whatever reason, then you want to take a bolus through an injection. And so that's the other thing that we always, tell each other and help each other with. So just another point with being prepared.
Yeah, for sure. Yeah. Mm-hmm. So coming back to, Reva had her support. We took care of one another. Thank you for calming me down. You should have seen my husband. Okay. I'm okay. She's okay. I'm okay. We're okay. Everybody's okay. What about those individuals, in Serena's example, at a shelter? Maryanne, can you tell us a little bit about what these kinds of experiences, particularly Harvey, how that's come to find the support for people who have to evacuate to a location where they don't have support, right? How the DDRC has helped that?
Well, we have the Diabetes Disaster Response Coalition was formed in response to Hurricane Harvey, and it is made up of all the major diabetes entities, organizations across the nation. So it's very, very exciting that we have this resource. And they do have a website. It's diabetesdisasterresponse.org. And we also have it in Spanish, which is diabetesdisasterresponse.org. And it's basically a one-stop shop for both people with diabetes as well as for diabetes professionals. And there you can, get all your resources. Now, when there's a disaster that happens in the United States, including Puerto Rico, there will be activation of what we call the DDRC. And then they will have some people live answering the phone 24/7 for people with diabetes as well as for healthcare providers. and they will be able to help in many different ways. So if you're finding yourself in the need to prepare for a disaster, you want to go on the website and learn about how to prepare. And if you find yourself in the midst of a disaster with a problem, then you can access either through the internet or by phone. But it's a great help because it's a one-stop shop. And then just to talk a little bit about, banking off about the carbs in the shelters during Hurricane Harvey. I mean, yes, we went to a small shelter in Wharton, Texas. And when we walked in there, it was donuts, it was cookies, it was chips. They had bread, and then they had some luncheon meats. So they had a little bit of protein, but it wasn't, the best kind of protein. And a lot of people, had, of course, evacuated without any type of a preparation kit. So we were lucky through the diabetes disaster response to have a pack of insulin and syringes and blood glucose monitors and all that to be able to help the people. But just like, Serena was saying, there was a big challenge trying to get their blood glucose under control. And we were lucky enough to have a physician that was working with us. So we were able to help some people, but it takes a lot of preparation. It really does.
Yeah. And so just like, Reva was prepared with all of her contacts, the DDRC has made it possible that shelters are providing this sort of external support
Yes.
for individuals who may find themselves in a situation where they don't have their usual support. They don't have their contacts to call. They don't have, their supplies at hand. The DDRC has been instrumental in creating a plan for pop-up clinics at evacuation sites in any sort of natural or whatever disasters that we find ourselves in the future. So here in Houston, we all know that we're coastal. So being a girl who has lived on the Gulf Coast her entire life and whose family is from the Caribbean, there's going to be a hurricane, there's going to be a tropical event that is going to cause people to have to make plans. So Reva and Serena were amazing enough to come this morning and share their experiences of Laura. So the most recent event here, that while we were spared, we're thinking about our neighbors next in Louisiana and everywhere that got the rain events from them. But if you ladies can just walk us through kind of what happened with Laura so that we can have, real life planning and see if that strikes a chord with anyone watching today.
So for Laura, because of the pandemic, I had been living at my house for a little while, but I wasn't able to evacuate per se to my parents' house because we have older people who are immunocompromised, so it wasn't the safest situation to evacuate there. So I was able to stay at my friend's guest house because they have kind of like a farm setup going on. So the way I prepared was I made sure I had gas in the tank. I made sure to order my groceries. I use a delivery service, so I had planned for that with a lot of non-perishable, so canned items were a big necessity to stock up on. Bottled water, Gatorade for Lowe's, nuts, that sort of stuff. But I think my favorite thing to stock up on is bone broth because that's high in protein. You don't have to refrigerate that. It's very low in carbs, actually no carbs. And if you mix that with like octane oil, brain octane oil, it gives you a longer longevity for the protein. So I like to mix that and keep me going. So I had stocked up on groceries, and then something I did this time, which I had learned from past experiences, was stocking up on my insulin. So prior to when it started to come in the news as a tropical storm, before it was a hurricane, I decided to refill that insulin just in case. So I was able to fill that on Monday, picked it up on Wednesday, and was ready to, have myself prepared. So I think, that's what I did in that situation to prepare.
Yeah, that's super. Those are some things that I think we get messages about. People will receive messages, but then they don't walk themselves through it, right?
Yeah.
So then you find yourself, I think one of the important things that you said was it was the Monday before, like as it was forming, you got all of this preparation ready. And I know that Serena, how much medication do you have on hand? And do you always keep it on hand?
Honestly, now I do. Before I didn't really. I'm just being honest, y'all. Before I would just be like, oh, I'll deal with it when it happens, because it was, for me, it was a lot of hassle trying to just get the extra. But I have things set up now. Like when they told us Hurricane Laura was coming, I made sure that I had at least 30 days worth. And for my injections, they last even if you take it out of the refrigerator, they last 27 days. So I was stocked up on that and my oral medications and vitamins, my vitamin supplements and stuff like that. We had lots of water and stuff like that. I didn't have to worry about gasoline and stuff like that. I don't drive right now because I'm working on trying to get my family, y'all don't tell them, trying to get them to let me drive their car. I have been dealing with
I think it's out right now. I think it's out.
been dealing with being visually impaired because of diabetes.
Right.
And so, but this last year was the worst, but this year is getting better. So I just had to make sure I knew who I was riding with and when we were going to decide if we had to mandatory evacuate, what we're going to decide. But Laura, it didn't, affect us, but I know there are a lot of people who were affected.
Right. Well, I think just being prepared, and I like that Reva brought up about the getting the gas tanks filled. So, whether you have diabetes or another chronic condition or no conditions, you have to realize that if the power goes out, you're not going to be able to get gas because the pumps won't work. And I just wanted to, reach out to our friends and our colleagues in the Philadelphia area because, they don't get the hurricanes like we get, but they do get nor'easters and a lot of winter storms and blizzards and sometimes the remnants of the hurricanes that hit us farther down south. But, the power goes out and the same thing can happen up your way. And if it's in the cold weather, now you have to worry about, being cold and freezing in your homes. So, if you get stuck, you can be sheltering in place because of a blizzard. And one of the things that you can find on the Diabetes Disaster Response Coalition website is whenever a state governor declares an emergency, there are going to be the pharmacies have ability to fill some of the prescriptions early, especially for things like insulin and diabetes medications and for heart medications and things like that. So you do want to always, check in with that website for the Diabetes Disaster Response Coalition, or at least become familiar with your pharmacy laws during emergencies. And that can just be as simple as talking to your pharmacist when you go to pick up your prescription next time. I think a lot of times we forget how valuable our pharmacists are. They are such an important part of our healthcare team. And I just can't say enough about recommending to my patients and my family members about using your pharmacist as a great resource. So that's just another thing that we found out.
And Maryanne, I have one more thing to add. So a lot of us are on these pumps now, the tandem pumps, and they have to be charged. So
Right.
another thing to keep in mind, we kept being told, high winds are going to be affecting the Houston area. So one more thing that I would suggest in preparing for these types of situations is charging up your battery packs so that you can charge your pumps and yourself, obviously, but more importantly, your pump. And I think that's something that's not intuitive, like right off the bat, because some of us were used to, batteries being the power source for our pumps, and that's not the case anymore. So prior preparation prevents poor performance.
Absolutely. Great. That's great. That's really great. Reva, with your specific type of pump, can you also charge that in your car charger? Can you put that, how you charge your cell phones in your car? Can you charge your pump that way?
Yes, but a lot of the newer cars now have the USB-C input. So that's something to keep in mind too, that you need adapters to charge your pump.
Okay. But just keep in mind, so, if you have to think outside the box and outside the next box, then that may have to be where you have to go. Exactly. So I would usually call it, contingency planning. And then I would say have plan A, plan B, and plan C. And sometimes, unfortunately, you're at that plan C. But I think that's a great point, because we do forget. And you can also use those battery packs to charge your cell phones too, right?
Okay. Yeah, and they're relatively, inexpensive. There's also, we have one that helps to it's like this big jumper cable thing that has a bunch of different adapters. And so it depends on which phone you have, but universally the USB in your car is super for helping you to charge those things. So we were talking about as well. So you have people who are living with diabetes on pumps and on technology. And then there's also people who are living with diabetes who are doing multiple daily injections or MDIs. So can we come back and talk a little bit about the longevity of insulin once you have lost power?
Yeah. Well, I just know just from experience that it does last. Well, I can't say insulin, because there's insulin injections, and then there are the non-insulin injections. Yeah. So I know, for example, that the non-insulin injections last 27 days after it comes out of the refrigerator. And I know one thing I wanted to add about, I know Reva was talking about the her pump and stuff and charging it. There are people who don't use CGMs, they use the regular glucometers. Stock up on the batteries for those, because that happened to me during Hurricane Ike. Do y'all remember that one?
Yeah.
We lost power for months, power and water for months, and I was pregnant. So I didn't have enough batteries. I had to go everywhere to try to find the battery for my glucose monitor, because it was important, especially since I was pregnant, to check my blood glucose level. So that's important. At that time, I was taking insulin, because when you're pregnant, you can't take oral medication, stuff like that. So we were fortunate enough to be able to go to a hotel. I went with my mom to a hotel, and they had a refrigerator, so we were able to refrigerate my insulin. So that's
awesome, Serena. So I guess moral of the story is, please don't throw out your medications. Inside of the packaging, each different type of medication that you may be on, they have different packaging. Yes, there's like a million words on them, but just pull them out and look for the bold words that tell you how long these medications will last without or with refrigeration. Different meds last slightly different. There's like 48 days, there's 57 days. I'm not sure why the days are that way. But wish it was straight across the board the same. But that's a soapbox I'll talk to them offline about. Okay. So,
okay, sure.
I'll just put my 2 cents in the big pharma.
They always listen to us, Joy. They always listen to
every
us.
time. So, but read your inserts and see, how long will my medication last. And so this brings me to maybe some like quick tips for packaging your items, like your diabetes care items, packaging them so that you can always be on the ready. Some of my patients use little containers. Some of them use those like big tough boxes. I remember as a kid living with people who were living with diabetes and living in a hurricane zone. Always having a tough box and then packing it every year ahead of storm season. And that was, waterproof. It was ready to go. Everything that we needed was in there. And so if we needed to evacuate last minute, if we needed to evacuate to a hotel, if we needed to evacuate very, very far, we just grabbed that box and loaded it up with the rest of us and headed out. I know Reva and Serena are all in for making sure that we have protein on board, because those are going to be the more difficult things to find and to access, especially if it's an emergency situation. What else should go into those boxes, into your supplies?
I know for me, what I have now, because I never really prepared before, but now I'm learning. So what I have now is I have water, I have my protein, I also have some crackers, because in case my sugar gets low, like I'm one of those people that when I started changing my food and stuff, I was addicted to sugar. So me carrying candy with me was not good. Okay, candy's not the option for me. Okay, so I said, okay, if my sugar is low, I'll use crackers, Ritz crackers or something like that. And also, like I said, water. I forgot water, crackers, a canned chicken. I don't really like tuna. Don't beat me up. I don't like tuna. But I also would have some juice. Now I would use juice because I wasn't addicted to it like that. I just can't take candy or something like that because I'll eat all of it. So 100.
I'll eat all the candy.
I used to love candy. Okay, okay. Let me get back on the subject. So it will be that, and also things just to make sure that if my sugar is low, I'll be okay. When I say juice, I mean I'm not talking about juice cocktail. Not talking about juice cocktail. The 100% juice, like I like grape or orange. And so those are the things that I would keep with me. I would also pack some nuts for protein as well. Like sometimes I would do peanuts. I know they're high in fat, but I like peanuts. And almonds. And that's about it. As long as I have those items, I think I'm okay.
So things that aren't perishable, that's some of the things. So we've got our battery packs. We have our glucometer batteries. We have our insulin in there, perhaps with something like a cooler case. We've got food stuff that we need, and we've got treatments for hypoglycemia in there. We have a quick question that ties into all of this from Barb. Barb is asking, for those on insulin pump therapy, should they have vials and syringe syringes or pens as backup. And definitely, I think all of us on this panel, yes.
But also, Joy, in your preparedness kit, you should also keep site changes.
Yes.
Oh, right. Yes, definitely. And if you have insulin pens, make sure you have pen needles, because you can't be able to use them without that. The other thing that I wanted to just inject was that you should have some change of like clothes, maybe a sweater, maybe some socks, maybe even an extra pair of very lightweight shoes. One of the things that we found is that, you know, if there's water or, you know, even if you're in the north and it's a blizzard, you know, you need the extra clothes if you're stuck somewhere and you get cold. But definitely if you're walking through the water, especially if you have diabetes, you don't want to get your feet wet and let them stay wet. You're going to you'll end up with a lot of problems. So make sure that you put some clothes in there as well. And again, if you go back to that diabetes disaster response.org website, they have a checklist there, so you can just print it off and you can make sure that you have everything that you need. And then you can even customize it and add some extra things to it. You know, and also, just like Joy was saying, like they would prepare their kits every year at the beginning of the hurricane season. Well, you know, if you have your kit ready to go all year long, because, you know, if you're living in an area where you might get tornadoes, they don't have much warning, or any other type of events like fires. So what you want to do is go in and make sure periodically that you check that nothing is expired. So usually what we teach is, like, if you're going to have a special time of the year when you're going to change the batteries in the smoke alarms in your house, that's actually a good reminder to go in and look at your ready to go kit at the same time and just make sure there's nothing in there expired. I had a kit here and I was using it for teaching and I hadn't checked it in a long time. And the tuna in my kit was 2 years expired. So just saying, you know, even though I teach this, you know, I need to do better myself. So yeah, that was probably not going to be a good thing if we had opened that tuna.
Exactly. And we would just use up the supplies after, you know, after, I don't know how long the hurricane season lasts now. It's like, it's supposed to be November 1st, but who knows?
Right.
And so we would just use it up in the next year before we restocked for the year, because you can use, you know, you can use bone broth for soups in the winter time. You can use you can pull out your Gatorade and use it during the year if you need to. All of those things can be utilized. So coming back, because I think that one of the things, you know, that is very personalized is treatment of lows. And I just want to tell everyone that it's okay to treat your lows how you want to treat your lows. Okay. However, if you have been, you know, I have patients who have been living with diabetes for 20 years and some patients who have been living with diabetes for 2 or 3 years. But within those span of amount of time that you're living with diabetes, people have different experiences and taste buds and all of these things. So some people, you know, will say, go to straight up, you must use glucose tablets. Okay. What do you ladies say about that? Let's start an argument.
Glucose tablets are nasty. Oh my God. Okay. When I had one doctor, because I've had
Ray was getting squared away. Go ahead.
I had one doctor that he would always give me glucose tablets, like, you know, before I left. And I'm like, this was when my sugar was running low a lot. We were in the process of trying to figure out, you know, my treatment and what was going to work for me, how much insulin and all this other stuff. So my insulin did get low. One time it got down to like 35. Wow. And I had it near me and I was like, I shouldn't care what this tastes like, but this is very disgusting. Okay, this is nasty. I'm not telling people not to use glucose tablets. Please don't think I'm saying that.
No, not at all.
I hate those things. It doesn't matter if it's berry flavor, orange flavor. It doesn't matter.
It doesn't matter.
Okay.
It straight up tastes like chalk in your mouth. They're gross. So,
so here's the thing. So every time someone comes in, I simply just ask them now, because that's part of our training. Our training is the 15-15 rule, 15 grams of carbohydrate, wait 15 minutes, recheck your blood glucose. I think that one of the things that's most important in that is that I mean, you should know how much glucose is in whatever it is that you're using. Some of my patients use little juice boxes that are exactly 15 grams of carbs, or they know exactly how much of their gummies will impact their blood glucose. And I just let it ride, because if you think about it, the experience of having a low, you're feeling a lot of emotions in that moment. And there's fear and there's anxiety. I want you to do whatever is most comfortable that's going to help you immediately. One of the things that I try to focus on is making sure that you keep it in your mouth. Okay, so one of the reasons that you are keeping it in your mouth, whatever it is that you're using, if you're using the chalky stuff, if you love it, do it, right? If you're using juice, if you're using goo, the runner goo, those kinds of things, the little liquid type ones. Reva's like, heck no, not using that. But whatever you're doing, hold it in your mouth. The cells of your mouth can help to absorb the glucose into your bloodstream. And so that's why we have spit and saliva. It starts to digest foods. And so if you can get something that you can hold in there, as gross as it might sound to you, it helps to keep it there. That way it doesn't have to go through the entire digestive tract before being absorbed in your intestines. So it will be a little bit more immediate. But I think we're all here to tell people today, this morning, you heard it here on My Diabetes HQ Live, treat your glucose with something that you can tolerate. You don't want to be running from the tablet when you're having a low.
Okay, now I'm going to bring us into argument now, because I always teach glucose tablets. I love glucose tablets. I tell my patients, every single one of my patients, I recommend glucose tablets. I have eaten them already. I think they taste great.
Yes,
they used to come out
experiencing a low doesn't eat it. What if they don't eat it?
They do, because it's, if you're really that low. So I have family members with diabetes, like many of us. So I think it depends how low you are. And if you're really, really low and you're feeling really, really awful and you're not feeling nauseated, then you will love glucose tablets at that time for that moment. Mm-hmm. But I also have had patients who like to go low, because they would always tell me, well, that's when I eat my Snickers bars. And I'm like, okay, well, that's probably not a good idea. Let's look at Snickers bars in another light, not as a treatment just for your low. So I'm going to ask Joy, what do you think about the fat content in some of these like regular chocolate candy bars?
Yeah, do tell. So what I usually do, and because I think I found it very useful engaging my patients with what it is that they want to do. Okay, so it's kind of like, it's something that I think has grown on me, especially being a mom. The sort of, do it because I told you so, doesn't work. Okay, so to all you moms out there, Mom Truth Saturday, I guess it is. Your kids are not going to do stuff because you said I told you so. But if you give options, half the time people are able to rationalize, right? So they may really want to have juice, but they may go pick up the little tiny juice containers that have 15 grams in them and then drink them. And so I think having that, that buy-in is really, really important. In terms of what to use, I explain why we prefer not to use candy bars, right? So you've got three main food macronutrients or things that break down in your body to become energy. So you've got your fat, you've got carbohydrates, and you have protein. Protein is going to take a long time. It takes about, depending on your digestive tract, like how well you break down food, it could take 2 to 4 hours before the energy comes from protein. With fat, it could take 3 to 5 hours before you get energy from fat. And carbohydrates are the most immediate. So depending on how processed they are, they're going to raise your blood glucose within 1 to 2 hours. And so it's really important when treating a low, especially if you're symptomatically low, that means you are having symptoms of a low and you've checked it and it is low and it's heading lower. You do not want to take in a candy bar that has peanuts in it, that has milk chocolate in it, that has tons of fat in it. It is going to take a really long time to increase your blood glucose. So you'll be living in a state of fear and anxiety and all of the symptoms of a blood glucose low for a very, very long time. And then on the back end of it, because you'll feel the need to keep treating your blood glucose low, you may end up with a very high, something that just shows up on your technology or on your machine as HI, which is not.
Yeah. So Joy, I wanted to actually bring that up. So I'm glad you did. You know, I've heard from a lot of people, and me myself, I've experienced this, that if I drink like juice per se, and then if I don't feel better like quickly, I'm overcompensating, and I literally will open the fridge and eat like everything I can find, and then there's a huge like spike on the back end.
Yep.
And so it's this continuous like
Roller coaster
through. So how do you avoid that? Because I know I'm not the only person. A lot of people have told me that when they're low, they're just like, give me everything, you know?
Yeah. So in some situations, you're going to feel that way because that's part of the anxiety, right? That's part of the fear. If I don't get something in me, something really bad's going to happen. And so knowing what symptoms you start to experience at the front end of a low will help you catch it a little bit sooner, right? So some people have a CGM that'll tell them, you can set an alarm to warn you at 80, at a number that you don't feel any symptoms, but just reminds you, okay, maybe you should start eating now so that you can catch them ahead of time. So if you're having continual lows all the time, we really need to find out what's causing those lows so that we can avoid them. Then having something at hand that's already portioned for you. So some people have, little snack bags with their 10 gummies in them.
Right.
And they can grab those 10 gummies, and because they've experienced it, they know that those 10 gummies are going to work. And then they maybe add 10 more. But if you're completely unprepared, you fall back to fear.
Exactly.
And then do that, right? And then if that happens, it doesn't mean that it's wrong, right? So if it happens and you end up on the high end, on the back end high, then we also need to have a plan in place for how do I take care of my high? Am I going to give correction boluses? Am I going to drink plenty of water? At which point will I be able to move, to walk down some of my glucose levels if that works for you? Because remember, that's another, diabetes likes to throw in wrenches. And so for some people, a walk might make them high. So, you plan on both ends. And then if you make a misstep or a decision that didn't work, you give yourself a break and then come back to it, reassess, and then know how to move forward on that the next time. So we really want to avoid the diabetic coaster, as my dad and I used to call it. He was like, first I'm high, and then I re-look, and then I high, and then I look. And so all day, if you get on that, you will feel badly for that day and the following day. So if you slowly raise your blood glucose with a controlled amount of carbohydrate, whatever it may be, you can slowly raise it to, 100 or 120, eat and then start your day off over again. So thanks for bringing that up, Angel. I think it's a conversation that I often have with people, you know.
And I think what I see a lot too, just with people coming in the hospital, is that a lot of times I'll ask them, so tell me about your sick day plan. And that's when they say sick day plan. And then I know, uh-oh, they don't have one. So I just want to bring that up, that if you're a person out there and you don't know what a sick day plan is, or you don't have one, please have that conversation with your physician or your provider for diabetes, because that's exactly what Joy was just talking about. You know, you need that plan for when it's low, but then you also need that plan for when it's high. And if you are supposed to do any type of correction, if you're a person that takes insulin, then you want to have that information from your healthcare provider. The other thing is, you know, checking for those ketones, just like Reva was telling us about, is so important. And then like what Joy was talking about, that, you know, could exercise be something you could do if your blood sugar is high? Well, again, that's going to depend. Do you have ketones, and how high is your blood sugar, and what kind of diabetes do you have? So, you know, those are questions that, you know, just like we're talking about preparedness today, it doesn't have to be preparedness for big events, big natural events. It can be preparedness for our day-to-day living. You still need those plans. So, yeah, absolutely. Yeah.
So I was going over, as I was preparing to come on and have a morning conversation with y'all. So after I was, you know, just living in my happiness about being on a show with you incredible people, my good dear friends now, I hope you think the same. As I was sitting there, you know, thinking about it, I read a really great article by a psychologist, PhD, Lisbeth Medlock. She wrote about 9 lessons that we learn from mistakes or missteps. And the one that sits most with me, that touched me most when I was thinking about our conversation this morning, was the concept of looking and thinking about what has happened to us in the past, and then using that to gather feedback, and then looking at it through a 3-questioned lens. Okay, so the 3 questions being, how can I use these experiences, or this experience that I'm experiencing now? How will I do it differently next time? And then valuable for planning is, how will I be different? How will the situation be different through my preparedness for the next time? So is that kind of how you all problem solve, you know, living with diabetes, helping others living with diabetes? Do you kind of look through those lenses of how have these things empowered me to move forward?
Yeah, definitely. I think like learning experiences only prepare you for how to do it better the next time. And, you know, being an advocate, you're able to leverage other people's experiences and kind of learn from them too. So that has been helpful in my experience.
What do you think, Maryanne?
Well, I have a little story, if we have a moment here for it. But during Harvey, I had a patient that came in the hospital, and his wife was there with him. He came in for very high blood glucose, and his wife also had a chronic condition, but she was, of course, not hospitalized. She was just there visiting with him. And they told me their story. So this is kind of going back on what you said, what would you do differently? And so what they learned from their experience was they did prepare, both of them, because they had these chronic conditions. And when he put together his little supply kit with his, he actually didn't have his insulin out. He had his insulin in the refrigerator, but he had a 3x5 index card with a note on it that says, take insulin. And then he had his other supplies there, and he put them on the dining room table, which was sort of near the front door. His wife, she got all of her medications together. They didn't need refrigeration, and she got all her necessary items, and she put them in her purse, which she put on the table that was in the foyer right by the front door. and the water started coming in their house, and they had to evacuate right away. And she grabs her purse filled with her stuff, and they run out the door, and they get saved, and they get to the place of safety, which was their son's house. And he realizes he left everything on the dining room table, and he didn't bring it. So lesson learned for them was put everything in the same place, the two of you together, because having it ready, but then not taking it with you, didn't help anything. So they did reflect back on what they could have done better next time, and probably would have avoided him having to come to the hospital. I just wanted to add one little extra thing about whatever type of kit that you have. One of the things that we have found is get some reflective tape and put it on the outside of whether it's a backpack or it's a plastic to-go kit or whatever it is that you're using, and not only keeping it very visible wherever it is that you're going to have to exit, wherever you're at to evacuate, but if the lights go out and all you have is a flashlight, you're going to be able to locate this to-go thing much easier if you have some reflective tape on it. So that's been one thing that we've been talking about nationally and just advocating for.
Yeah, that's super. That's a great piece of advice, I think. Sure. So Serena?
Yes.
We're talking.
I know y'all keep losing me because my connection is tripping. I don't understand what's going on.
Oh, sorry.
That's okay. I just want to say, I know that today we talked about a lot of things, but me dealing with people with diabetes and peer support, a lot of people don't have the support that other people may have. They don't have anybody to call or anything like that. So I think a very important part of disaster preparedness is preparing a support team. Even if you can't, if you're like, well, I don't get along with people, and trust me, y'all, I've heard it all. I don't like being around people. I like being by myself. But no man should be an island. Everyone needs somebody to lean on some particular point in time. It's okay to lean on someone. It's okay. It's okay. It's okay. I don't know how many times I can stress that it's okay to lean on people. So find some people, even if it's not people in your family, because I've heard, well, I don't like the people in my family. I've heard so many excuses why not to find a support team. But find, even if it's not the people in your family, try to go around and look around for at community centers, a group of people, diabetes peer support, shameless plug.
Yes.
People, a team of people that can hold you accountable to what you need to do. It's very important to actually prepare for a disaster, because when you're alone, it's kind of hard to, you may not have everything. You may not even had the money to take care of preparing yourself, so those things are important. Let somebody know what's going on. Let somebody know if you need something. Don't be ashamed to do that.
Yeah,
that's a great point, because people are there to help, and even we as healthcare providers, we have friends, we have family, and we're always there to help each other. So just please reach out. I think you're so right. Don't be afraid to reach out. People are there to help you, and if they can't personally help you, they can help you find the resources maybe to get that help.
Yeah,
exactly.
That's so super, guys. And I know we're running on fumes here, but if there's anything that you all want to say before I wrap it up, here's your moment. I think those are some really important points. All right. So again, to recap, Serena advises us to find our support. Find your support, reach out, even if it's through, friends who have been shaped into family. Find communities like the peer support groups in your community that can help you build your network, and come with a plan. Okay. So this has all been a really, really important talk this Saturday with our colleagues and our friends. Thank you, ladies. Thank you for spending your Saturday here. It's meant a lot to me and also to people watching. and who will watch. Here.
Absolutely.
To all of our viewers, we say thank you, and we hope that this conversation has made you think about your plans for being prepared in actionable ways. We hope that we've encouraged you to reflect upon uncomfortable and difficult situations, even those outside of what we traditionally consider disaster. Ask yourself how you can use those experiences, what you would do differently next time, and how you will plan for the future. Reach out, help out if you can, and prepare to be prepared. Continued gratitude to our friends and colleagues who took their time out this morning to share and be an inspiration for others. Mark your calendars. We will be broadcasting every Saturday, 10 a.m. Central Time and 11 a.m. Eastern. Our next episode will air on Saturday, September 12th, when our panelists and guests will hold another important conversation to positively impact diabetes care and promote advocacy. Thank you for being a part of the My Diabetes HQ community. Remember to like this broadcast and subscribe. Use the SurveyMonkey list listed on both YouTube and Facebook to provide feedback on the broadcast and share your ideas for how we can improve and bring more information to you. Remember, the content shared during the My Diabetes HQ live broadcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. We always encourage you to seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding diabetes or any medical condition. See you next time, everyone.